Good afternoon, Sarah here again from the Centre for Mental Health. As promised, we're keen to keep you updated about all things mental health, and this week we're going to talk a bit more about inequality. We did touch on it last week when we were talking about children and young people, but I thought it would be really good idea to kind of keep talking about the issue that's so important to so many people. If anyone saw the Panorama documentary on Monday about health inequalities and heard the three stories from Rob, Yvonne and Ingrid, I think you will, like me, probably come away feeling really disturbed and worried and anxious for those people, but also for many people who find themselves in those situations. I think it was an interesting reflection on some of the things that we as an organisation also feel incredibly concerned about. In Stockton, the life expectancy is for men is 64. That's quite extraordinary, and I think it's extraordinary on so many levels. All of the stories that were discussed as part of the Panorama programme were related in some way to mental health. So in Rob's case, who's facing a terminal diagnosis, who may leave a very young family, it struck me as his current situation, not only dealing with his physical health challenges, but profound mental health challenges, thinking about building and developing resilience for his children who are going to have to live without him once he passes away. Painful stuff. I think of Ingrid, who is a woman suffering from deep, dark depression, who faces suicidal thoughts on a regular basis, who without the support of a local voluntary group would probably be incredibly isolated and alone. And then I think about Ingrid, the grandmother who is looking after her grandchildren because her daughter has a very serious drug addiction. All of those people, in the face of their life challenges, also having to manage both physical and mental health difficulties. You know, the Centre for Mental Health really cares deeply about this, and all of us, for very many reasons, for which I'm sure will be revealed as time goes on. If you're interested in inequality in the same way we are, then do keep in touch with our Commission for Equality in Mental Health, which is going to tackle some of these issues. We have also launched, and will formally launch in September, Equally Well, a campaign that's very much about trying to close the gap between physical and mental illness. It might be surprising to some people to realise that people with schizophrenia are likely to die 15 to 20 years before the general population. If you're shocked at that statistic, then you're right to be. There are many reasons for it, but all of them are preventable and unacceptable. Please do engage with what we're doing and find out about Equally Well and find out about the Commission for Equality. It would be really helpful to know from you what you think could really turn the tide in relation to inequality and mental health. We don't have all the answers. You might. Keep in touch. See you next week.